Hello, welcome back. I hope you guys are all doing well. My name is Adam Luke with SessionWell. We are having an awesome podcast this evening on how do couples navigate trauma. So this one's going to be a good one. We wanted to create SessionWell. This is our, Freddie, what's the number now?
Number 8.
This is our 8th podcast. So why did we create this? We wanted to create a space for therapists, whether you're licensed, you're pre-licensed, or you're just an everyday person trying to find something that might apply to you. Maybe jog your memory. Maybe you're looking for therapy. Maybe you're just looking for resources. We wanted to create a space for you. Please follow our page. We have SessionWell, and then we also have a community group for SessionWell as well. So if you have questions, concerns, post on there. We're good to go. But my awesome co-host over there.
Hi, I'm Judy again, and tonight we have a wonderful guest named Robin Felix, which we'll introduce a little bit more in a second. Those of you that can't join us on Thursday nights, because I know it's an 8 o'clock time slot, we have kids and dinner and jobs. You can also listen to our podcast on Google Play, on iTunes, on Spotify, and then next week we're actually going to do something next week we're taking the week off because Adam's out of town, and then so we'll be back here on November 8th. And we're actually going to go YouTube Live instead. So that's just another platform for you guys to be able to listen to the content. But we are super excited for tonight. This is Robin Felix. We've worked with her for a few years, and it's just such an honor to have you here. So thank you so much for being here.
Well, thank you for inviting me. I appreciate having the chance to spend some time with the two of you this evening.
Thank you.
So what's a little bit about your background?
Oh, okay. Well, I'm a licensed marriage and family therapist. I am also the chair of the Master of Science in Counseling at Hope International University. I participate in a small private practice for therapists in Fullerton, CAV Family Therapy. Definitely growing. A little bit about my background. I'm trained in EMDR. I do a lot of work that is trauma informed. I've worked with the birth to 5 population with child-parent psychotherapy, which is a trauma-informed system. I'm certified in trauma-focused cognitive behavioral therapy, and I've had the privilege to work with couples, and that includes working with couples who are first responders and military.
Nice. And so when we ever have guests on this podcast, we oftentimes will ask them, what do you want to talk about? And Robin had said that she wanted to talk about trauma and how it affects couples in their relationships. Yes. And I guess I'm just more curious, what made you decide to pick that topic for tonight?
Well, there are a few reasons. One is that I come from a military family and a law enforcement family as well. So the area of trauma is something that is constantly being discussed in our home in terms of, what family members have experienced, what other people have experienced that we know, and just watching the wars that have been unfolding the last 17 years. But along with that, it also seems to come frequently into my practice. That I'll find I am addressing clients who've had some kind of trauma experience, including first responders and military. So that's definitely important to me. It's just always been on my mind that we do a lot of work around trauma in the individual. We don't hear a lot in our industry about how it affects couples, and that's so important because especially if you're dealing with a family, the couple, the parents are the foundation of the home, right. And that needs to be solid for the family to grow.
So also something I'm hearing is, I imagine when you set out and you said, I'm going to become a licensed marriage and family therapist.
Yes.
Was this the niche you set out for?
No.
Okay.
No. I thought I would be hearing about things like, we're having a hard time deciding what is going to be date night and who gets to choose what we do.
We have paint swaps, and
yes.
which
we can't
one?
decide.
Yes.
We want the egg white or the off white.
Right. Right. Does the toilet paper hang over the roll or under the roll? Where do you squeeze the toothpaste tube? These were the things I thought I was getting into.
Right.
Juicy stuff.
Yeah.
So this is something that came to you.
This is something that came to me. It just seems that as my career has progressed, these are the clients that have come through the door.
Okay.
They brought their hurts and their pain in. Wow. And so it's just developed that way throughout my career that's the direction I've gone in, is dealing with trauma.
So, like, when you were developing as a clinician, so I'm sort of also hearing, like, as your clients were growing and gaining more access to their own lives, you were growing as a clinician and how you could help them.
Absolutely. Absolutely. And I think one of the biggest lessons I learned is that working with clients who've been through traumatic experiences, and with any client really, we can't do anything to fix the situation. We can't make it better for them. We can't fix them. What we can do is we can walk alongside them and let them know that they're not alone, and that we are willing to do whatever it takes in terms of the clinical process to help them get where they want to go, to help them heal.
So, trauma has become something that you definitely have a heart for.
Absolutely.
It's weird to say that, right?
It really is, but yes.
But you have a heart for the individuals who have experienced traumas.
Yes.
And then you are completing a PhD program with a pretty amazing dissertation that you're doing.
I am. I'm completing a Doctorate of Psychology in Couple and Family Therapy at Alliant International University in Irvine. And my research question is, what are the lived experiences of military couples where the veteran is returning from combat in Iraq or Afghanistan with a traumatic brain injury?
Wow.
Yeah.
And what made you decide to pick that as your dissertation topic?
Well, as my husband and I have watched the wars in Iraq and Afghanistan unfold, and we both come from military families. Our fathers were both in the Army. Mine served 2 tours in Vietnam, and his father served in Korea.
Wow.
And having had that background and that awareness of what PTSD has been for our veterans coming back from combat, we saw that traumatic brain injury was unfolding as that new signature injury for these wars that truly wasn't understood, and certainly not in terms of the effect that it has on relationships. And so for me, it was just taking that passion and that empathy for our military service members and their families coming back and wanting to be able to do something that would be useful to serve them in clinical terms.
Okay.
Are there certain signs or symptoms of a TBI? Are your clients aware of that when they come see you, that they've had?
My clients, by the time they've come to see me, have been diagnosed, but they aren't necessarily aware, even when they arrive home, that that's what they've had, a traumatic brain injury. And that's because a large number of the TBIs that have occurred during Operation Enduring Freedom, Operation Iraqi Freedom, Operation New Dawn, have been from blast waves, from blasts of bombs, things blowing up.
Things that service members may not actually think of, like, oh, that caused some sort of concussion.
Exactly.
Because I didn't fall out of a helicopter.
Exactly.
Right. It wasn't
directly hit in the head by something.
Exactly. There was no open wound to the head. It's what we call a closed head trauma. So they may have suffered physical injuries that they could see on the outside and not have been aware that blast from a rocket-propelled grenade or some kind of IED actually rocked the brain and the skull and caused some injury. And so because the majority of the injuries that are coming back, the TBIs that are coming back, are classified as what we call mild, although this is a serious injury, but in terms of classification, they are considered mild. The symptoms might not make themselves evident and really point to the fact that it is a brain injury. So sometimes it's a process of finding out as they're going for treatment for other areas, or just trying to figure out why they're having memory loss, why their moods are changing so quickly, why these things are so different, finding out as they're being diagnosed for something else, or it may just unfold as they're being assessed in some way.
Okay. So please enjoy your sip. We're just sort of grilling away on
I
you.
know. We have so many questions.
It's okay.
So we sort of talked before we fired the podcast up of this event that happens with when you get married and then your spouse is deployed.
Yeah.
And then your spouse returns, whether or not a TBI is there, but comes back on deployment, has rest, is able to go back out on deployment. But that can be a traumatic experience in itself, right? Just each deployment has its different features. I remember speaking to one service member's wife who said, literally, my husband came back different every time, and it was almost like I got a new husband and he got a new wife, because our lives continued to progress whether or not we were next to each other.
That's very true. I actually saw that with my own parents as my father came back from Vietnam from 2 different tours, that he was different each time. And my mother has certainly noticed it as well and said the second time significantly different. And that was when she recognized later on that was what was his PTSD from that second time. But yes, so it's a matter of the family has to prepare to separate. They realize they're going to have to take on different roles while the service member is deployed. They find the person who stays behind often finds new competencies in themselves. Right. So it's very difficult to have that separation and come back together. And to add to that, going through combat, going through these deployments and the stress that puts on the service member and the family members because they're worried about their loved ones. And I've heard that often. My husband was different when he came back. My wife was different when she came back from the deployment.
So, have you ever had to navigate that with clients that you've worked with? Of, how do we either create a space for that returning service member, or how do we as a service member have increased capability of letting the system slowly, gradually change to my presence being there? Because the way that I've experienced just through friends, I've never had the privilege of serving, but through friends that have returned, that service member is so excited to be home, right?
Yes, and the family's excited to have them home.
Of course. And so it's like,
yes,
let's have it. And there's almost like this returning honeymoon period, right?
Yep.
But then I remember my one friend who had a young child. He's like, I have this kid to take care of, and then all of a sudden, my wife's like, well, no, I do it this way, and I do it this way, and I do that, and no, I do it this way. And for him, it was almost like, I can't exist in my own home. It was almost like I was the toy that came home, and you had your few days, weeks of euphoric time together, and then he almost looked forward to deploying again. And that was something he wrestled with.
I've heard service members say they feel out of place when they come home, and they feel like they don't fit anywhere.
Okay.
And what you're saying is exactly right. So as a family prepares for deployment, obviously as they become a couple, they've had these dreams of what their life is going to be like, whether they're going to raise children together, how they're going to go forward in life, and that gets interrupted. And then you still have those dreams coming back together as a family, and obviously it's hard to put that together the way it would have been before deployment happened. So it can be really tough on them. Some of those dreams get shattered. Some of them get sent in a different direction and have to be changed a little bit. And that piece about coming home and not feeling like you fit, and first everybody's excited that you're there, and then that sort of, like you said, sort of wears off. And then you realize that you're anticipating coming home and being that person you were before and stepping into the role of what you did. And in some ways, it's almost as if the family has gone on without you. Right. And I've had service members tell me that they felt perhaps not needed in their family. So one of the things I encourage couples to do is to try to put themselves in each other's shoes. Treat the issue not as something that's in the service member or in the spouse that stay behind, but as something you set on the table in front of you, and you sit side by side and look at it and sort of ponder it, trying to do that without any emotional reaction. So this is something we're solving together. It's not something in you. It's not something in you. It's something we have in the space between us that we need to address.
Wow. That has to be powerful when you can, just as a couple, reach that point, right? When it's not you, it's not me, it's not independent problems.
Right.
But I just know from my own couples work, when we can move a couple out of the whose marriage is it or whose relationship is it to a point of like it's our marriage and our relationship, then it becomes like, oh wow, we can actually build something together.
Exactly.
Because it's really hard to build a Lego castle when you don't have the Legos.
Yes, it is.
That's the easiest way I can go as a guy, and sometimes that's how it feels. Like we're fighting over Legos. No, it's what we build is us.
Right.
It's not, we're not on two different islands. It's like we're on the same island, and we need to like survive on this island together. So how do we do that?
How do we use our resources to do that? And there's some things that get in the way that become barriers. For instance, a service member who comes back with PTSD, TBI or no TBI, but PTSD, may have some hypervigilance. There may be problems I've heard them describe it as they feel as if their head is on swivel. They're always looking around for the danger that could be coming, and where are we going to have to retreat to, or how are we going to have to defend ourselves? So there's that heightened awareness and that hypervigilance that comes with it, and even that piece all by itself, if the relationship is just perfect. We know that never happens, but close to perfect. Just having that issue of being so out of regulation or dysregulation, as we would say in our profession, can make it really tough to connect with the other person in the room. Yeah. Because if you're really worked up and you're focused on, your adrenaline's up and you're just really tense, you can't focus on what's going on around you, in terms of the day to day.
Right.
So part of what's really important is to help the service member and the other partner also learn how to regulate themselves, calm themselves enough that they can relax and feel comfortable and safe in their environment, so they can attend to that issue that's on the table in front of them.
Because that hypervigilance at some point kept that service member alive, right?
Absolutely. It was a useful skill.
Very much so. They were able to return to their family. And so when you were speaking, I could only think again of my own family members and friends who have served. Like, they hate crowds, or they don't like...
4th of July.
4th of July is a very,
hard.
very hard one.
Yeah.
Another one I have is just, a family member who... certain way that people approach can really, you can watch them change, right?
Yes.
And so then there has to be a battle with empathy from the spouse who simply just is like, let's go to the movies, or let's just go to a restaurant and have a date. Right. And I imagine there has to be difficulty in building that empathy back of, like, that hypervigilance is not a characteristic that service member probably loves to have because of the amount of impact it has in their own life.
Exactly. And as you said, it was being in that heightened awareness is something that probably kept them and their buddies alive at some point. You come back here, you find out it's a skill you've developed that you don't necessarily need. And your spouse or your partner can have so much empathy, but at some point they do want that date night. They do want to be able to go to the grocery store with you, or just take a walk around the block, just to have what they see as a normal life that maybe you two had before the deployment happened. So it can be tough.
So how do you work with those couples that want those things, and maybe the service member is, I guess, not as excited about doing those things? Or when I get a lot of couples too where they just feel disconnected, like, because they don't want to talk about what has happened. Right. But maybe partner wants to know or wants to be able to be a support to them, but they just kind of learned and been trained to not share those emotions.
Sure. So you're bringing up two really important issues. One is, how do you get back to that normalcy and having that connection? That's a very important thing, and it can be really tough, and it can take quite a bit of time for some. I mean, there are some people who come back and they are able to get back into some sense of that normal routine easily, and then there's some who end up in our offices that it's a real struggle for them. So it is really hard to ask a spouse or a partner to make the space for that time, which can be lengthy. But understanding that they also need that relationship with their partner, however it's going to reform, or as they reunify, they still need that. So for me, part of it is not just working with them as a couple, helping them make meaning of what they've been through separately and together now. There should also be a component of some kind of individual therapy for both of them.
Yes.
Yes, and I think that needs to happen with a different set of therapists than the one who's doing the couples work. So that's an important piece.
Well, because I think of it this way. That service member, the government spent years training them to be what they were, right? And then I wonder, do we actually afford them the same time or process to train to be the new person they are?
I would say we don't.
And that's like from society, right? So
right.
I look at the fact of my heart absolutely bleeds for our service members because of what they are willing to sacrifice for privileges that I get freely. And so when they return, we needed them to fight for our freedoms. Then when they are no longer fighting for our freedoms, where is the space that we place them in?
Right.
What?
How do we make a place for them as they return in the community?
Yeah,
Where
and
they feel like they fit into the puzzle.
do they even get afforded the freedoms that they have fought for us?
Those are good questions. And wrapped up in that is something that you brought up, Judy, and I'm about to lose it because sometimes when you're 55, you have that moment. You mentioned two things. You talked about the service member coming back and sharing what they've been through,
or like not wanting to
or
share.
not wanting to share, and that's a really tough piece. And it's not something that I ever tell my clients, yes, you need to share that, or no, you don't. They need to make that decision for themselves, but not. I'm sure in our hearts as a society, we want to make room for them to come home and to feel like they fit. And sometimes I wonder if we don't know how.
Okay.
At the societal level. There may be some of us who have some sense of bits and pieces of it, but I'm not sure we know how to make them a space where they feel like they fit. And that's one of those pieces. Okay. One of the reasons that I've had veterans tell me they don't share is because they don't feel that their families or friends would understand. And rightly so. It's an experience we haven't shared, and so often I'll suggest that they turn to their military buddies, and they do to have those conversations. I think there's a lot to be said for continuing to have those relationships with people you've been through combat with, to share the difficulties of coming back. Having that support is really important. I don't think it's necessary to tell your partner everything you've ever been through.
Yeah.
What I think is important is to be able to share with your partner how it's affected you in terms of being back here. Because this is the present that you both have to deal with. But that doesn't mean that you have to give them all the details.
So I hear a very important part that I haven't really ever thought about in the fact that they need to maintain their connection with that community that they battled through war with.
I think it's important they formed relationships with these men and women that are, it's a brotherhood and sisterhood and nothing like what we have here in the civilian community.
Because I've heard more from spouses that are like, well, he or she just is always talking with we're no longer at war. And I always have wrestled with that as a therapist of like, you're right. Maybe you and I are not at war, but he or she is still experiencing what they had to throughout the day. Because we all can, at some point, empathize with micro and macro traumas of our own. That driving down a certain street that we had a car accident on, we remember, the smells of life, right?
Right.
The statures of people who are around us. We can easily go back to traumatic moments in our own life.
Sure.
But then we sort of discredit that when you're like, well, you're walking through a Walmart. Why are you flipping out? Well, because I keep hearing things drop on the ground.
Right.
Or I remember a vet that I worked with that he loved his job at Home Depot, but he had a really hard time with blocks of wood being dropped on the ground accidentally because it'd make a sharp clap. And it was like, wow, like the things again that I take for granted.
Yes.
That I can be around loud noise, I can go to places and not have that worry.
Yes. You bring up a good point, because something that happens for us when we go through a trauma is that whatever we're exposed to, certain sounds, sights, smells, things that we take in with our senses become associated with dangerous situations, that put us at risk. And so what is our brain and our body going to do? They're going to have memories of this, and the next time a reminder of it comes up, our brain and our body are trying to make sense of it. Do I need to prepare myself for, to protect myself and my family, or is this really just nothing?
Yeah.
But the thing is, those are important skills. And it's like you said, having those in combat keeps you alive.
Right.
Not necessary here, but the problem is the brain and the body can't just shut them off.
They don't know the difference.
No. Exactly. And if it was an intense experience, it is seared into your muscle memory, your memory, and your brain as well. So.
And so how
very
would you
difficult.
How would you define trauma? Because I feel like trauma, the word trauma has been used a lot lately. And people say there's like a big T, little t.
Sure.
And what are your opinions on just the definition of trauma?
Sure. So trauma is a situation that can create for a person or for someone near you, a threat to your physical safety, your emotional safety. So that's a trauma, but you can also be traumatized. So we can experience a trauma and process that and get through it, but we can also be traumatized by it, and the experience, the response that we have to it at the time, which is that, necessarily the fight, flight, freeze, whatever it is that's going to get us through it, can carry through and not become resolved, and so it carries on into our regular day-to-day and causes problems with functioning. Right. And then you talked about big T and little t trauma. So when I've worked with small children, we talk about little t traumas. Those are the things that if you are, a toddler, an infant, a small child, you might not have the skills and the resources or the capacity to get through and resolve on your own. You might need help from a caregiver. Those wouldn't necessarily traumatize an adult the way they would a child. And then there's the big T that would traumatize even someone who had the capacity to process and resolve issues, to keep themselves safe, to be able to get out of a certain situation, to drive away in a car, to make decisions about changing their living arrangements, whatever it took. So then we're talking about things like, like hurricanes, tornadoes, gun violence, these things that are really, really heavy stuff that we can walk away from as adults, but children couldn't.
So I think that's a good way of segueing that trauma doesn't just happen to our law enforcement community and to our service member community, but they happen to all of us, right? None of us are immune to trauma.
Exactly.
So have you ever experienced it where couples will minimize their traumas?
Not be aware of them?
Not basically they come to you for couples therapy and they're like, traumas? No, we're great.
We're just talking about toilet paper.
It doesn't exist.
Yes, I've seen it in both instances where the reason they're coming in is because they're dealing with some trauma, perhaps what we call a big T trauma. But I've also seen couples come in where some of the difficulties or conflicts in their relationship are born out of some traumas that they've had maybe in childhood, maybe those little T traumas that were so subtle and so much a part of their day-to-day when they were young, and especially at an age when they didn't have language skills, that they aren't, as adults, necessarily recognizing that these experiences, these traumatic experiences that they've had are something that are coloring their relationships with their intimate partners. Absolutely. So part of what my task would be in that situation is to help them to go through a trauma timeline, do a history of their lives, looking for ways that perhaps they might have become vulnerable and had to learn to live in the world in a certain way that's now coloring their adult relationships. And that can be pretty eye-opening for someone.
Yeah, I'm sitting here and I'm like, oh.
Adam's like, when I was 5.
Do you have them do it together? Like go through the timeline together so that way each partner can see the other person's timeline?
I actually do, but so what I do is I start with a couple having the first 1 or 2 sessions together, and I'll just briefly touch on things that they may both be aware of, but then I also take them into individual sessions after that and have them do a thorough genogram, what we would call a family tree, and a trauma timeline for each of them.
There you go.
And then we'll talk a little bit in those sessions individually about how that might or might not be coloring what's going on. And obviously I give them room to reject that because this is their life, not mine.
True.
And then I'll talk to them about bringing that back into a couple session to formulate a structure of what might have been bringing on the conflict or making it difficult to deal with in terms of what they've been through.
So when you're talking about coloring, what I'm hearing from this is the fact that I may have a trauma in my life, my wife might have a trauma in her life, and that the way that we experience each other may be based off of how those traumas have impacted us, right?
Yes.
And maybe my empathy for her trauma will be affected greatly by how I consider my trauma in my life.
Sure.
Because I feel like sometimes our couples come and they're like, well, my T isn't a big T, but it's bigger than your T. And so, like, I can get loud and be an ass because my dad was really an ass. And so, like, I'm allowed a certain level.
Sure.
Where the other side may not also have that empathy because, well, no, my tea.
Right.
It's almost the worst trophy display that we have.
Yes, exactly. And so one of my tasks as a therapist is to, rather than figuring out whose tea is bigger than whose, is to have the couple in front of me, but to be alternately working with each of the spouses or partners to provide empathy for what they've been through. So one of the things I do when I work with couples is I ask that at first, when we're together in session, that rather than talking directly to each other, they each talk to me in turn. It gives the other spouse or partner a moment to witness what's going on and to not feel like they have to be defensive or prepare an answer. So when I talk to Adam, I'm only talking about Adam's stuff and giving empathy to Adam. And I might turn to Judy and say, did you know that about Adam? And you might say, no, I didn't. And I might say to you, now that you know that, does it change the way you see things at all? But that's where I'll leave it. And then when we're ready to turn the other direction, I'll start to talk to Judy about what she's been through and then provide Judy with empathy. And I might turn to you and say the same thing. Did you know that Judy was feeling like that because of what she'd been through?
Well, so really I can just try to put myself in that moment. That takes a lot of that power or that defensiveness away. Because it seemed like as you were doing that, you were diffusing the situation, right?
Exactly.
I feel heard because we have this connection.
Yes.
And then when you turn to her, I can still be processing and paying attention, but I don't have to be holding back with that next verbal jab per se.
No. And the only thing I want to know from her in that moment is was she aware of your experience?
So it's like bringing in the partner into the experience, but it's also giving each partner their time and their space to be able to say what they need without having the other partner feel like, oh, no, but it's my turn. Or like talking over each other. Yes.
And I make sure, too, to tell my couples, if you feel like I'm going too far in her direction and I'm not giving you enough of myself, let me know. I'll come back to the middle.
Okay.
Because that's where I'm supposed to be, is right in the center somewhere. What I've noticed in doing this, and this is part of IBCT, Integrated Behavioral Couple Therapy, as this progresses and I'm able to model the empathy with one spouse or partner and then turn and do the same for the other, it's amazing that after a few sessions, they'll come in and they'll start doing it for each other.
That's good.
So you'll actually watch them turn.
Yes. And that's when I know we've had a major turning point in the process.
Yeah. And then what is it exactly that you called it?
Integrative Behavioral Couple Therapy.
Okay.
It was developed by Andrew Christensen, who was out of UCLA, and the late Neil Jacobson. This is their system. And it's very effective with couples in developing empathy. Teaching them how to accept each other just as they are. Doesn't mean they have to forgive, being flawed or imperfect or maybe even wrong sometimes. But accept us as we are, just as we are. Yeah. And then once we've accomplished that, moving on to, and how do you want to change together as a couple?
Wow. So that I can be accepted in my brokenness at this present moment. I don't have to do something to be rewarded.
No.
With love.
No. Exactly. Now, one caveat to this is that we're talking about situations where we're not necessarily dealing with domestic violence or some kind of abuse going on in the home.
True.
That is a different level of treatment that we need for that. This is the average. We have a conflict. We've tried our own way to work it out. Hasn't done so well for us. Yeah. Taken us down a road that we didn't want to go. And now we want to find a different way to do this.
And what would you say to a couple that's thinking about going to couples therapy, but like really hesitant about it? Or just scared?
That's a good question. I would say, first of all, that when they go in to see a therapist, they need to make sure it's a good fit for them, that they feel comfortable and safe. That is probably the biggest piece right there.
So they can one and done, never go back.
You know what? If it's not a good fit, sure. It's like anything else we do in life. You're forming a relationship. It's a professional relationship, but it's still a relationship.
Yeah, people have said that it's like finding a therapist is like dating.
Exactly.
You have to keep dating around until you find the right fit.
That's right, and then marry the one that fits.
Yep.
There you go.
Figuratively.
Don't leave me.
Yes. Yeah. There's a pamphlet for that. Anyways.
Yes.
I think you also bring up a great point of really putting in perspective what that therapeutic relationship is.
Yes.
I don't think I would ever stick with a actual general physician who was overseeing my care if I didn't feel safe and bringing my physical problems to him or her. And so if you again feel that way, it's not a designation of your failure in therapy or your failure to face trauma.
Not at all.
Because I can definitely know that I've sat with people who have felt that way, like, I've been to a couple therapists, and I'm thinking it's just me now. Right. And we can find ways to reason ourselves out of all therapy offices, but it doesn't necessarily mean that you don't deserve to find the place you fit, right?
That's very true.
I know that for me in my own personal therapy, I knew I was at the right place when it felt like home.
That's a good way to put it.
It wasn't necessarily, I had a bunch of great recommendations. I'd been told this guy was awesome. But when you sit down and you experience it, and you have that experience of I feel safe, I feel like
heard.
You know, the way that I've described to my wife is like, it's like a warm blanket. Like, it's just that you just feel ready to talk.
Yes.
And that there's not that pressure. And so when you find that, then you know you're there.
You're in a good place.
If you don't feel like you're there, keep searching, please.
Absolutely. There is nothing wrong with shopping. Yeah. And as therapists, we shouldn't feel like we have to fit every client. It might be that, and we shouldn't have any, feelings that come out of a client saying, hey, you don't fit with me. It's just the way it is.
And we have so many referrals and I would never want a client to just stay with me because they felt bad to go to somebody else. I'm always very open about, if this isn't the right fit for you, we have plenty of referrals in the same, city. I'm more than happy to give one to you, because I think just as therapists, we want them to receive the best care. Exactly. And they're not going to receive that if they're not comfortable with us.
Yes.
So I think I think it's great for them to we have so many people
there are plenty of us out there.
There's a lot of us.
And we all have our strengths and our giftings and our ways of going through the therapeutic process, and so it is important to find a good fit.
So in closing, I think we always want to bring up in these podcasts for the people who are thinking about becoming therapists, right? And so something that I know that I struggled with before I entered into becoming a therapist was whether or not my personal traumas or my brokenness were going to predispose me to be a good or bad therapist. Now, we have the privilege of having you here as a chair of a program. And what do you think on like how do you navigate our past experiences, traumas, brokenness? How does that work into who we are as therapists going forward?
It's a really good question, and it's an important issue. In fact, I had a student come in and ask me that very thing just this week. Very, very important. And what I tell students and even other therapists that I work with, pre-licensed, licensed, is that it's important to be aware of ourselves and what we've been through. That's really important. In part so we don't step in it when we're in a session. But we do not have to have resolved everything about ourselves or our own traumas in order to be effective as therapists. What we do have to do is have really good boundaries in the therapeutic setting and realize that the purpose of us being in that room is for our client or our client's benefit. So if you find your own stuff coming up, then you need to sit in that chair as a clinician and ask yourself, can I use this in this moment to benefit my client? No benefit to me, but benefit my client. And if I can't, I need to put it aside on a shelf until the session has ended. And then once my client is on their way, I need to go and deal with this on my own, whether it's having my own therapy, talking to a colleague, or doing some self-reflection, some kind of mindfulness.
So what I'm hearing, because here's a buzzwords that all these students they're gonna be like countertransference, transference, all. But what I'm hearing from you is not so much a fear that those are going to happen, but more of an understanding that when it does, I will know what to do with it.
Yes.
Because I feel like sometimes as therapists, the worst rumor about being a therapist is that if you have any hint of transference or countertransference, you're just terrible. You should probably not be in this field.
Oh my, I would say if you do have any hint of transference or countertransference, it says something about your sensitivity as a human being, which is an important quality in a therapist, to be sensitive to human beings. It also says that you are human.
Yeah.
And it's just a matter of learning how to take care of it and use it clinically to help your client, or set it aside until you can take care of yourself. But we do not not need to be perfect to do this work.
There's no such thing as a perfect.
There
are
no
therapists
perfect
or
humans
clients out there.
There would not. There are no perfect
would
humans
have a
in
job.
the world. There was one, and he left this earth some time ago. Yeah,
The perfect therapist.
Yes.
he is the perfect therapist. Yes, he is.
Well, thank you so much for being willing to
you.
spend time here with us. You have blessed me with 45 minutes of some good stuff.
Every
I
time we
really-
talk to you, Robin, it's like, oh my gosh, I learned so much.
I really appreciate having the chance to be here with two of my favorite people tonight.
Oh, well, thank you.
We loved having you.
Now,
Thank
how
you.
would someone find you if they would
How
want
would they
to?
find
Yeah.
you? Well,
I mean, I guess I got a context preference to that. You know, let's say they would love to have therapy with you, or
Okay.
how could they get a hold of you?
sure. Well, if you want to find me in terms of looking for a therapist, then Google Robin Felix at Psychology Today. If you're interested in becoming a marriage and family therapist or a licensed professional clinical counselor, we have 2 graduate programs at Hope International University. One is the Master of Arts in Marriage and Family Therapy, which is on ground, and one is a Master of Science in Counseling, which is an online program. So, again, Google HIU and look us up.
Perfect.
And we're biased because we also graduated from HIU, so we promote this program a lot.
Yes. I mean, I think we had a discussion last week. I was speaking with Heather Silva and then Dr. Susan Hastings last week of just what hope meant to me at that point. So you may hear our bias, but it's because hope is my clinical home.
Right.
you
It's a
know?
family.
Yes, absolutely.
It is a program that is different because we are not huge, but we are family and we turn out competent people.
We do.
So,
We do, and I'm biased too. I'm also an alum of the MFT program, and working there, I get to see the quality of student that we have, and I'm pretty impressed.
I'm excited for the next generation, right?
Me too. Yeah,
Yes.
they're amazing.
Yep.
Yeah. Well, thank you so much, Robin.
You're welcome.
Thank you guys for joining us.
Thank you.
So next week, again, we're going to take a break because Adam's out of town. So we'll be back on November 8th with a group of therapists. That one's also not to be missed. If you want to listen to this podcast, go ahead and look at Google Play, iTunes, Spotify. And then on November 8th, it will be on YouTube.
And so just in case people are like, November 8th, that's more than a week away. We're actually going away for 2 weeks. Thanksgiving, we aren't going to be doing one either. So
Right. So we have one November 8th, November 15th. And then we have
Yeah.
Thanksgiving. We're taking a break. And then we'll come back again in November. So we have 3
Yeah.
Novembers.
perfect. I actually was wrong.
Okay,
My
so I'm not
calendar's
sure.
off in my head.
That's okay.
November 8th. Sorry. This is why we do it live.
Right.
We got 45 minutes of good content and then I screwed it up. So see you guys. We appreciate
Thank
you.
you.
Bye-bye.
Have a
Bye.
good night. It's okay.
Yeah. Hey.